Hello and welcome to African American Health Matters.
This is Ed and Pat Sanders with health tips and information because your health does matter. The information in this broadcast is not intended to substitute for personal medical advice. Now, before making any decision about your health, please consult a physician or a qualified healthcare professional. Our organization has over 103 partners across the country who are dedicated to patient education, advocacy, and finding ways to better access health and disease resources for African Americans. This broadcast of African American Health Matters is one of the health outreach tools used to reach millions. Thanks to Cyberstation USA, and thanks to you for tuning in.
African American Health Matters is a new mobile health text message and multimedia outreach that provides health tips and reminders to subscribers right over their cell phones. Our website, www.africanamericanhealthmatters.com, has updates and information about diseases, tips, audio messages, and later this year, video slices of doctors talking about critical diseases that affect African Americans.
Over the past few weeks, we've interviewed physicians about a number of diseases and health matters that relate to our health and discussed how various diseases and health issues specifically affect African Americans. There's so much information we've gotten from our physicians. We want to thank them for taking the time to educate us about African American health matters. This week we want to start wrapping up some of our previous interviews, so for this show, we're going to have a full half hour of doctors we've talked to in the past, continuing their discussions about various diseases.
Dr. Joe Webster is founder of the Comprehensive Center for Digestive and Nutritional Disorders. He built the Imhotep Health and Video Complex that houses the Webster Surgical Center in Tallahassee, Florida. He's going to be talking to us about acid reflux and gastrointestinal diseases in African Americans.
Okay. Do you think people with acid reflux should wear like loose-fitting clothes, or, maybe eating on the run is bad? I mean, what would you suggest some tips maybe for people with acid reflux with regard to their clothing and the method that they eat?
Well, eating habits, I think that we can sort of cover two birds with one stone, as I like to say.
Okay, good. That's fine.
I think proper eating habits are good for your health in general, but certainly eating the fast foods and eating too rapidly and not taking proper time to eat, eating a lot of the highly spiced and sweets and carbs and all of that, especially spices, they can promote the symptomatology associated with acid reflux and make it more bothersome. The coffee, excessive use of coffee, caffeine, all of those things. Mm-hmm. And certainly cigarettes, which is not a food.
Absolutely.
Smoking and too much alcohol is just bad.
Yeah, okay, that makes sense.
So proper eating, taking time to eat, eating when you're not stressed, all of those things are good for health in general, and they also are good for proper digestion, and therefore they would be better for a person who has reflux disease. But what I would like to always try to tell my patients is that proper eating is good for the entire body, not just for the stomach.
That's right. That's true.
And so it's good. You want to eat a healthy diet, healthy heart, healthy colon, healthy brain, healthy stomach. I tell my patients a healthy diet is a healthy diet if you do it properly.
Yeah.
And taking time to eat, your fruits and veggies and all that properly, will cut down on your acid reflux.
Yeah.
Are there any particular exercises we could do to offset acid reflux?
Unfortunately, no. Only the direct effect would be losing weight if one is overweight. But otherwise, there is not an exercise that I'm aware of that would decrease the chance of reflux. Some exercise activities would, of course, increase. If you're a weightlifter and you're lying on your back straining, doing this,
or hanging upside down.
Hanging upside down.
Yeah.
Yes, reflux. Ironically, since you brought up exercise, runners, when a person is running, there's a certain amount of reflux that can and will take place. And so sometimes pain on running It may not be cardiac. It may be acid.
Oh.
The only way to know that is to have your heart doctor tell you that your heart is okay.
Okay.
But when one is running, there's a certain amount of reflux that's going to be taking place, and if that person has significant reflux, they may get chest pain from either spasms and or the acid literally burning the esophagus as they run.
Okay. Now I had another question, and it relates to hilar hernia. Can you explain what that is, and how does that affect acid reflux?
Okay, that's hiatal hernia.
Hiatal hernia. Okay.
Right. Hiatal hernia. Well, the hiatal is the hiatus is an opening in the diaphragm, and so a hiatal hernia simply means that the hole in the diaphragm that allows the esophagus to go through is bigger than it should be. And so when a little baby gets an umbilical hernia, then where the umbilical cord should come out, that hole is too big, and therefore a little protrusion takes place.
Okay.
Hiatal is the same analogy. The hole there has to be a hole there for the esophagus to come through. When the hole is too big, not only can the esophagus come through, but a little piece of the stomach will protrude up into the chest. And as that happens, then one has a hiatal hernia. The relationship between the hiatal hernia and acid reflux is, again, not linear. Many people have hiatal hernias come with age.
Okay, I didn't know that.
Get about 40 to 50 years old, there's a good chance that half the people at age 50 would have a hiatal hernia of some degree.
Wow.
And so we just thought to do it numerically. So 50 is 50.
50 is 50, okay.
50 is 50.
Okay.
And then you go up literally 1% a year. So 60 is 60, 70 is 70. So by the time you're 8 or 9 years old, you got a very good chance of having a hiatal hernia. The simple presence of a hiatal hernia does not mean you're going to have acid reflux. On the contrary, the absence of a hiatal hernia does not mean that you will not have reflux. So you can have acid reflux with or without a hiatal hernia.
Is that hernia more prevalent in men than women, doctor?
No, it's age-driven. It's really age-driven.
And how would one know if they have a hiatal hernia?
Okay. Well, I wouldn't have to focus on that because for the reason I just mentioned, it's you get 50 years old, you have a very good chance of having it.
Okay. Yes.
So it's not worth doing a test or an X-ray.
Okay.
What is more important is whether or not you have acid reflux.
Okay.
You'll get an idea that you have acid reflux by some of the symptoms, and if you have a routine examination or your doctor refers you to a gastroenterologist for some other reason, then of course they'll do a proper test to diagnose it. But so-called typical heartburn, everyone knows you eat burning in your chest, or you can eat something citrus product or chocolate bar. And alcohol and chocolate. Since a lot of time people go out to dinner and have a nice cocktail after dinner, and then they get back to the hotel and get home and eat a bunch of chocolate. That's a perfect combination for reflux.
Okay.
Now, I also heard, I need to know if is there any truth to this, doctor, that once you have your GERD problem under control, that it could possibly offset any dairy problems you may have. Is there any truth to that?
Well, I don't like to make real hard statements.
Okay. That makes sense, sure.
The person has lactose intolerance, and they get gas and bloating and difficulty when they do consume dairy products. If I'm hearing you correctly, someone said that if you control the GERD, then the dairy products would be more tolerable.
Yes.
I would say that there may be some overlap there. I think what quite often happens is some of the symptoms that people think that be coming from the GERD, I'm sorry, from the dairy products,
lactose.
Those symptoms were probably acid-related symptoms.
Oh.
If something went away when you took the antacid,
right,
or you started eating properly, then you probably were not correcting your dairy problem intolerance. It's just that you would get rid of the acid or the reflux component of it. because it's almost like the antacids. The antacids only relieve acid, basically, and they don't have that much impact on liver function. Now, what can happen, to sort of segue into that, 20% of black people have bacteria in their stomach called H. pylori.
Okay.
And H. pylori, the bacteria, can cause symptoms of bloating and gas and other kinds of things in addition to pain. So sometimes taking the antacid that's necessary to control the antacid, if taken along with antibiotics to get rid of the bacteria, some of the symptoms will go away because you've now gotten rid of the bacteria.
Okay.
Okay.
And there's also, I understand there's something also in the market called probiotics that's pretty good for that problem.
Well, probiotics, and what I like to dissect out when we're having discussions with my patients is I like to make sure we're talking about the same thing.
Mm-hmm.
When you say good for that problem, then I want to say, well, probiotics are good for a particular set of problems in the GI tract.
Okay.
But they are not necessarily going to relieve
acid reflux.
Okay.
It just gets you the good bacteria.
There are motility issues, and there's irritable bowel syndrome, and constipation, and bloating, and things of that nature. That there is a place for probiotics in assisting in the management of that. Diarrhea-like syndromes, and inflammatory bowel disease. So there's a list of things that probiotics will have their proper role in assisting in managing.
Okay.
I like to try to dissect that out because I use the example of putting gasoline on a bicycle tire. Mm-hmm. Gasoline works quite well for a gas-driven engine, but it does not do much for a bicycle tire.
No.
That's right.
And so if you do medicine, you say, well, the doctor's medicine didn't work. That's where the medicine worked quite properly for what it was designed to do.
Okay.
It was not designed to make your bicycle go faster, therefore it didn't do that.
Okay, that makes sense. Now, I guess one of the wrap-up questions would be, a person has acid reflux, and you use the word typical. What is not typical? If you're having acid reflux, what? 2 or 3 times a day, 2 or 3 times a week, 2 or 3 times a month? How would you just generically classify atypical acid reflux?
Good question, because about half the population probably reflux once or twice a week, and don't burp here or there. It could be more of a person vomiting several times a day and or manifesting some of the complications or symptoms that we talked about, troubling them frequently at night times, or be associated with anemia or blood in the stool, anything that would tip your hat off that they have more than just a little minor reflux.
Okay.
The ability to a little food to come back up in the esophagus, it happens in probably half the population.
Okay.
Every now and then, but no more than once a week, probably, and 2 or 3 times a month in the general population.
Okay. Well, that's a good indicator.
Colon cancer.
Dr.
Each
Webster,
year,
we
close
thank
to
you so very much for
150,000
your
people are
time.
diagnosed with
Thank you
it,
so
and
much.
50,000 people
Really
die from it.
appreciate last
It's
minute
the
too. You're a
disease no one
jewel.
wants to talk about.
Okay, well,
But when
thanks for
faced with such alarming statistics, isn't it time we did? The fact is, colon cancer is the second leading cause of cancer deaths in the United States, but it can be prevented if caught early. Colon cancer prevention starts with you. Learn the risk factors, recognize the symptoms, know your family history, and understand your screening options. This is a cancer you have the power to do something about by getting your colon checked. A screening test, such as a colonoscopy, can reduce your risk of developing colon cancer by up to 80%. Getting a screening test gives you the chance to detect colon cancer early, before it's serious. For most people, screening should start at the age of 50, but doctors recommend that African Americans start earlier. African Americans are far more likely to develop colon cancer, so getting tested needs to take place when you're 45. And if you have a family history of the disease, make sure you tell your doctor you may need to be screened even earlier. Again, you can do something about colon cancer. Since 1999, the Colon Cancer Alliance has made it its mission to increase awareness of colon cancer by developing a variety of local and national programs to help educate the public about the disease. Whether it's fighting on the steps of the nation's capital to ensure health plans cover screening, or holding free educational seminars to provide support for those diagnosed with the disease, the Colon Cancer Alliance takes pride in finding new ways to raise awareness. Educating you about screening tests, supporting patients and families dealing with the disease, and reducing colon cancer rates through events held in cities throughout the U.S. are just a few of the Colon Cancer Alliance's many efforts. And it's working. Because of the work of organizations like the Colon Cancer Alliance, people are starting to talk about the disease, and that's what it's all about. Talking is the first step to making colon cancer a thing of the past. Remember, you have the power to do something about colon cancer. Talk to your doctor. Reduce your risk. Find out more about colon cancer and screening options by visiting the Colon Cancer Alliance at www.screenmycolon.org. That's www.screenmycolon.org. Or call 877-422-2030 for more information.
We had a conversation with Dr. Angela Hill. She's a pharmacist and a consultant pharmacist and has been for the last 18 years. She's a professor, administrator, and a clinician who specializes in psychiatric and neurologic disorders, geriatrics, alternative medicine, and pharmacy communications at Florida A&M University, pharmacy at Tallahassee, Florida. Dr. Hill was very informative with regard to remembering to take medications. Many of our subscribers has asked for monthly tips to remember to take their medication, and here's what she had to say.
Now, there's usually no expiration on the prescription drugs, so how do we actually know when they expire?
Well, actually, that's not true. Prescriptions are written to be refilled within a year's period. We get them from the manufacturer on our actual stock bottle with an expiration date, but on the bottle that you get, there's also a date that's placed that respects the number of refills that you have, as well as the type of medication that you have. So, in general, a prescribed medication should be consumed, that particular bottle, within a year's time. Then there are some that are limited to 6 months, and then some that are limited to within a month, because they may never have a refill. But there is an actual date on your prescription label that tells you refills until, and that's the equivalent of an expiration date.
Okay. This is kind of off the record, and I don't know if I'll even use this or not, but there's this new drug they're raving about, anacetrapib, that's supposed to be good for cholesterol. I don't think they've actually done the phase 3 trials here in the United States, but they have done it in other places. And I was reading online today that also that niacin is good for high cholesterol. Is this true?
Well, niacin actually is helpful and has been proven. I'm not as familiar with the other product, and I might want to write the name of it down and investigate it a little bit.
Sure. It's been in the news lately. ANACET. RAPIB, I believe. If you Google it, it'll give you the right spelling of it. Okay. Anacetrapib.
Okay. Well, I may have to check that out. But with niacin, yes, the data definitely does show that it will help impact a certain type of cholesterol disorder. Now, that's our issue there, and this is why doctors are so important. We don't want consumers to blindly think everybody can take niacin.
I see.
Because we have different types of cholesterol within the context of total cholesterol. You've got good cholesterol, bad cholesterol, and then not so good.
Right.
And so the LDL, we use terms like LDL, HDL, triglycerides. Well, the niacin really only will impact triglycerides.
Oh, that's what it is. Okay.
Yes, so you have to be very careful to make sure that that person is appropriate for that. And also, some people can't really tolerate it because it'll cause flushing. And that'll, that's the scenario where sometimes using an aspirin is necessary because the medication causes that flushing.
Yeah, sometimes. Yeah, and they do have the non-flushing niacin, but most of it is not. You're right.
So most of it isn't. So that's one precaution. But with these other products, sometimes we have to look at that. One other problem you have, well, niacin causes flushing, but some of the prescription medications cause muscle pain and other problems. So but definitely the data is impressive that niacin can affect triglycerides. It's not considered what we say first line, but it is cheap, and it is an alternative, for some patients.
Now, I want to get your opinion. Again, we're still off the record on this. Get your opinion. Vitamins. Every doctor that I've ever been to that I talk about vitamins is kind of like a neutral. It's sort of a neutral reaction to it. I mean, they don't think it's great. They don't think it's bad. But doctors don't tend to talk about taking vitamins. Why is that, do you think?
I can't explain exactly why doctors aren't talking about it, but I can tell you what should happen. The American diet as we know it, obviously isn't up to par in what it should be. But consumers have gotten on this bandwagon of taking a tablet for everything, and vitamins typically get thrown in there because you do read about all these vitamins making a difference, a lot of medical problems. But usually if we just take a multivitamin,
yeah,
we'll cover all bases. The only other two that I think are allowable to supplement extra are calcium and or vitamin D.
What about C?
Everything else, vitamin D.
D, okay, D. Okay.
Vitamin D as in dairy.
Okay.
Because that will help calcium, be more effective in terms of our bone strength. And the older we get, we need, obviously need to be more concerned about bones breaking and those kind of things. But outside of that, a multivitamin is really all you need. One of the challenges with vitamins is that we have some that are water soluble and some that are fat soluble, and the fat soluble ones stick around and they cause big problems.
Oh, how do you know the difference?
Kind of leave and go into the urine, but the fat soluble ones are really easier to remember. We have an acronym called ADEC, so vitamin A, vitamin D, vitamin E, vitamin K.
Oh, okay.
Are some common fat soluble ones. All of our B vitamins, vitamin C, those are all water soluble, and so the body, will get what it needs, and then the rest will just go in the urine. So we have to be very careful when you use vitamins because you could take more than what's recommended, and then you get into those problems of it just going in the urine because it's excess, or it causing bigger problems.
I have one other question, Angela. I have a friend who is in pretty good health, and he just takes a one-a-day multivitamin. Now, it was recommended that he also take a supplement like a vitamin C or calcium. Now, he says when he just takes the multivitamin, he's fine, but when he takes the other two, he can't really tell the difference if he takes it or if he doesn't take it. I'm trying to figure out, how does this come into play, more or less?
Now, not knowing what else he's taking, I'm hoping that there's not something that's interfering with his ability to absorb them. But individual experiences with medications, you really have to hone in on the bigger picture. I look at the age of the patient, their ethnicity, comorbid medical problems, other medications they're taking, when they're taking it. There's numerous factors. The other concern I have is how much he's taking, and if he's taking an adequate dose to really make a difference or not. That's another concern.
Okay, that makes sense. You have done a fantastic job, Angela. Thank you so much. You will be our resident pharmacist for the time being.
Have you ever had a discussion with your healthcare professional about your weight and health? According to the Centers for Disease Control and Prevention, 68% of U.S. adults are affected by excess weight or obesity. In an effort to raise awareness of excess weight and its impact on an individual's health, the Obesity Action Coalition, a registered 501c3 national nonprofit, has launched the Your Weight Matters campaign to challenge all Americans to talk to a healthcare professional about their weight and health. Individuals affected by excess weight are at a much greater risk of developing serious health conditions such as diabetes, hypertension, sleep apnea, and more. To take the Your Weight Matters campaign challenge today, visit the campaign website located at www.yourweightmatters.org. Here you will find a wide variety of weight and health-related information to help you assess your weight. Campaign participants also receive an e-toolkit which is designed to help them prepare for their visit with their healthcare professional. The kit also includes a food diary, health and wellness tips, and much more. Isn't it time you started thinking about how your weight affects your health? Take the Your Weight Matters campaign challenge today at www.yourweightmatters.org. The Your Weight Matters campaign challenge is brought to you by the Obesity Action Coalition. The Obesity Action Coalition is the only nonprofit whose sole focus is representing those affected by obesity through education, advocacy, and support. The OAC offers many valuable educational resources on obesity, morbid obesity, childhood obesity, treatment options, and much more. For more information about the Your Weight Matters campaign, visit www.yourweightmatters.org or call 800-717-3117.
Each week, we bring you tips from our African American Health Matters mobile health text message service. So here's some for this week.
Here's one on asthma control. Living successfully with asthma means controlling your environment, close monitoring with peak flow meter, and a strict treatment plan.
And here was our inspirational message. Loving myself heals my life. Every cell of my body vibrates with energy and health as I nourish my mind, body, and soul.
Here's a tip titled Metabolic Syndrome. Diabetes, a condition characterized by elevated glucose levels, high triglycerides, low HDL cholesterol, high blood pressure, and obesity. See a doctor. www.johnshopkinshealthalerts.com.
Hypertension. Recent research suggests reducing salt can save lives and may lower blood pressure as effectively as increasing medication. Another one of our favorites from the Johns Hopkins Health Alert.
Here's one on arthritis. Make sure you get enough sleep, focus on the good, stand up straight, keep a journal, conservative footwear, watch your carbs and alcohol.
We hope through this broadcast and our website, you'll sign on to get health tips over your cell phone. The subscription is free and you can opt out or cancel at any time. So stay on top of your health matters by continuing to tune into this show as we build on Cyberstation USA.
Hi, I'm Jason Snelling of the Atlanta Falcons. On the football field, I face challenges head on. I do the same when it comes to tackling life with epilepsy. I was diagnosed with this condition while in high school and nobody was talking about it then. In fact, many people still don't talk about epilepsy because they worry about how they'll be treated when others find out. As a spokesperson for the Epilepsy Foundation's African American Outreach Program, I share my story to end the fear and mystery about epilepsy.
A public service from the Epilepsy Foundation.
Get the facts.
Visit www.epilepsyfoundation.org or call 1-800-332-1000.
Think you're addicted to food? You may be right. Researchers from Yale University wanted to know if some people's brains react differently to food, the way substance abusers' brains react to drugs. First, they asked 48 young women to answer a questionnaire to determine if they had symptoms of addictive-like eating behavior. Then they hooked the women up to a machine that measured their brain activity while they tasted either a chocolate milkshake or a liquid with no flavor. Women who scored higher on the food addiction quiz had more activity in certain regions of their brain when they were expecting food. These regions play a role in urging us to eat and are the same parts that motivate people with substance dependence to use drugs. People with higher food addiction scores also had less activity in certain areas that help put on the brakes after a tasty treat. According to the researchers, food advertising could make it hard for some people to stick to a healthy eating plan because of the way their brains respond to the ads. I'm Dr. Cindy Haynes of Health Day TV with the news the doctors are reading, health news that matters to you.
Be sure to tune in on Fridays, noon to 1 for African American Health Matters on Cyberstation USA. Monitoring with peak flow meter and a strict treatment plan.
And here was our inspirational message. Loving myself heals my life. Every cell of my body vibrates with energy and health as I nourish my mind, body, and soul.
Here's a tip titled Metabolic Syndrome. Diabetes, a condition characterized by elevated glucose levels, high triglycerides, low HDL cholesterol, high blood pressure, and obesity. See a doctor. www.johnshopkinshealthalerts.com.
Hypertension. Recent research suggests reducing salt can save lives and may lower blood pressure as effectively as increasing medication. Another one of our favorites from the Johns Hopkins Health Alert.
Here's one on arthritis. Make sure you get enough sleep, focus on the good, stand up straight, keep a journal, conservative footwear, watch your carbs and alcohol.